This is CareShift with me, Safik Bilakanti, and I'm so excited about our guests today. Joining me are Chirag Shah, who is an investor at Define Ventures, and Ian Chiang, who is an investor at Flare Capital Partners. This is the first time I had two people, and we decided to make quarterly healthcare and AI reports to discuss the latest trends in healthcare and talk about the rapid pace of AI and how it fits in healthcare overall. This was so fun to do. Chirag and Ian were amazing, and I can't wait to discuss the following quarterly updates and trends in healthcare with them. Chirag and Ian, it's amazing to have both of you on here today. So thank you both of you guys for being here today.
Appreciate it.
Yeah.
Absolutely. Happy to be here.
Yeah, thank you guys for being here. One of the biggest things that is kind of happening right now a lot in, I guess, in AI is a lot of different kind of tools that patients are being engaged with when it comes to a whole bunch of it. When we see ChatGPT Health, we see Anthropic. I wanted to first off get both of your takes on what the kind of future looks like for AI patient engagement and what is this going to be leading towards as we kind of go on to 2026 and 2027 and on. And any of you guys can start.
Well, Chirag, would you like to start first?
Sure. I'm happy to. And Ian, you should definitely add to this, change it, disagree with it. We can take it in lots of different directions. Look, I think for starters, the most important thing for all of us to recognize here is the rate of change. It's been, I think, from anyone's vantage point, one of the fastest rates of change we have seen in any industry over the short period of time that AI has really been at the forefront over the last couple of years. And I start with that premise just because I think it's been next to impossible to predict how this world is evolving. And I'm sure, like you, Ian, you meet people every day who are pushing the boundaries of what is possible and what is feasible. And that's probably the most interesting part of where I spend my time. I think if you were to envision sort of this concept of like, what is an ideal patient-provider relationship or patient-provider experience? Heck, if you even to zoom out and think about what is the experience any individual would want to have with the care delivery system, like if you look at it through that lens, I don't think there's a single point in that journey or experience that I'd sit here and say can't be massively improved. And to me, that entails everything from how do I go from potentially there's something wrong and I need to fix it, or even I'm not even sure if there's anything wrong here. I'm not even concerned about anything, but maybe I should just be notified that I should be thinking about certain things. So if you start with sort of like the discovery aspect, I think that to me is part one. Part two then becomes a question of how do you educate people on what available paths there are, because there are many. And I think customizing that path based on what somebody is looking for and what they need and how they want to experience care is, to me, the next biggest opportunity. And then the piece I'll sort of stop with, because I think we can take this in a lot more directions, is when I've decided that I want support or want help, what's the way that it's going to resonate best with me? Do I want that to be an in-person visit? Do I want it to be virtual? Do I want it to be asynchronous? Do I want it to be something else? And so I think about all those different places of surface area where we're going to see and already have seen some step change improvement. And to me, we're just scratching the surface there.
Yeah. Maybe I'll pile on 100% agree with Chirag on the speed of change. And maybe specifically, I would say technology will always continue to advance, and often both intended and unintended consequences are going to be byproduct of it. One of the things I would say will change dramatically is the patient empowerment of the tools. And what I meant by that is you are now suddenly every single one of the patients or caregivers of those patients have access to this powerful tool that can oftentimes, do a better job than many of the physicians or clinicians who have gone through decades of training. And that's readily accessible to the mass, right? Even for some of you, both of you know, I have recently gone through some family and personal health challenges. And as someone who's reasonably well informed, from a healthcare standpoint and a technology standpoint. While I'm not a physician, so there are still many of the blind spots having to go through such a high acuity specialty care. I became almost like a daily user of like ChatGPT as well as cloud when it comes to answering some of my questions, right? So we're not even talking about tools like Open Evidence and others that are specifically tailored for highly professional trained clinicians, right? But even for those tools, it changed the power dynamics between me as a patient or caregiver with the clinicians that's on the care team of my loved ones, right? So I think what that would likely end up both empowering the patients that we have never ever seen before, but some of the potential unintended consequences, and we need to thought through, right, in order for there's a broader adoption of the AI tools is what entails from liability standpoint, physician workload, right? Like the last few years, we have seen many of the clinicians are overburdened by the sheer amount of asynchronous messaging, both from the portal or even just sometimes patient text them directly. So that volume will continue to go up, and we have a workforce that's overly burdened. So how do we balance the two, right, to continue to drive for more of a patient-centered care delivery system while to fit into the existing, like, very, very, very brittle, like, healthcare ecosystem that there are many stress points.
Yeah, no, both of you guys brought up like really good points here where, we're already seeing a lot of like tools where it's making primary care much more accessible, where, you can just simply book an appointment online for, for example, like Doctronic, where you can just book an appointment online and then see a physician. Do you think these are going to be much more impacted for a lot of patients to make that much more virtual care? I mean, I see it on both ends of the angle where, we still want that empathy, the whole connection with the physician,
Yeah.
or we just want that prescription, we're done for the day, and then we can leave and do what we need to do next. I mean, and then there's also the kind of debate of like, when I'm in an emergency, the first person I'm going to be calling is my doctor, not
Yeah.
like Doctronic, right? I don't know. It's an argument. What does that kind of look like right now? And will that change when we kind of have more, I guess, models get better and kind of AI gets, I guess, much more transformational in that end?
Know that this is like an either or for me. I think it's a both and what I mean is I think we are going to be in a world in which we have the ability to scalably give people what they want, where they want it, and how. Historically, we only had one mode of doing this. All we had was in-person care. And so everyone had to fit the mold of what that meant. If you fast forward into what our world could look like in 5 years, 10 years, I certainly believe that we're in an era of atomic personalization, where if what somebody wants is and visit with a virtual doctor who can prescribe a prescription for something that's fairly low acuity and routine, we should give it to them. We should enable that, assuming it's got the right guardrails and bounds. I'm all for that. If, on the other hand, somebody does want to be seen by an in person clinician so they can have that experience, great. I think we should offer that as well. But I don't know that saying we're going to have one or the other only to me is the right framing. I think this is a question of how can we meet people where they want to be from a care delivery standpoint, such that we can address people's needs in the most diverse possible ways.
Yeah, I agree. And if I may add, I would just say, I think we're going to see greater stratification of different use cases and by different specialties. Some of the easier use case, and we see Doctronic in Utah, is focusing on medication refill, right? Like those are some of the tasks. I'm not a clinician, but when I talk to most of my clinician friends, like most of them, they are not the one doing prescription refill, right? It's someone who's like on their team practicing top of his or her licenses, right? So there are tasks for an AI model and potentially can even slowly moving up the kind of the value chain from use case standpoint. But I think there are certain parts of the care delivery you will always need to have a person involved, right? It's like that not emotional value. And even if the AI is more accurate than the the whomever the specialist that the patient sees, but there's a lot of the emotional aspect and also the counseling that while the AI can potentially be as empathetic and also as patient as it could be, but I think the touch and feel, right? Like sometimes, like for example, for those of you, like I went through a family member who was end stage cancer, right? Like so far, at least we don't have a physical robot that comes to hug the patient or hug the loved ones, right? I think there's going to be a stratification of many of the provider, the day to day, the tasks they do and how they interact with patients will be vastly different with the tools, right?
Right. And recently, I had on the pod Dimitri, who's one of the CIO of this company called Rad AI, which is more on the radiology front, kind of helping with radiology kind of implementation and making it much more better. And one of the biggest arguments that he mentioned is that radiology, more specifically, a good example where a lot of people think it's going to be one of the first specialties kind of gone with AI is that it's going to be working very much alongside him, alongside radiologists at the max, is what he's saying as of now. And that's one of the biggest things that they're advocating for at Rad AI. Is that kind of going to be like that for almost per specialty basis? Like, will there be any specialties that you kind of seeing where already to an effect where physicians are way too burned out and then now they're just like, we'll just go to the AI and kind of figure out what you need to do? Like, how will that kind at one point, will there be a specific specialty that's going to be kind of be not as much used, I guess, saying quote unquote, because of AI's work?
Yeah, maybe I'll start there. And I may even, in some ways, I agree with what Dimitri said. The reality, I think, there's all shades of kind of grays when it comes to where the future will be, right? But first, we also need to recognize there's an aging population and there's increased demand. And I had the good fortune several years ago serve on as an advisor to MIT has a more of a global initiatives on how do you bring innovations of healthcare to some of the geography. And of course, AI driven radiology was one. There was one company focusing on that, right? So I know often we talk about US as its own, but when we look around the world, right, that company, I mean, I'm going to get all the numbers wrong, but like in the continent of Africa, there's like literally countries where they have single digit radiologists, right? Like so I think the point of I don't think any specialties, at least from what I have seen, is going to be replaced because there's just going to be additional demand, right? AI will help accelerate and perhaps expand the patient panel size. But I think the doom of radiology will entirely be automated by AI. I think that's a little bit, at least maybe not in the next few decades, right? Because the fact that we continue to use more AI radiology tools, the number of radiologists are still being trained, and there's still a gap in radiologists in many parts of the US, right? So I think all these tools and all these specialties are likely AI will help expand the patient panel size in order to solve this insatiable demand that we have in our healthcare ecosystem. I mean, obviously, there are certain specialties more perhaps easier when it comes to AI tools can provide better diagnoses, right? I mean, pathology, there are a number of companies up and coming. So we can name a number of those, but I would just again reiterate, I don't think AI will entirely disrupt and there a day that like maybe we don't send anyone to the specialty of radiology. I think that's a little bit of a exaggerated, at least from pace standpoint.
Right. And in that case specifically, do you think a lot of times, when it comes to, the overburden of physicians and a lot of the staff members that's going on, what are the kind of things that founders are doing right now that you guys are seeing is kind of alleviating a lot of those tasks, whether that be on the front end or doing the quote unquote boring work in the administrative side for practices and things like that? Like, where does that stand right now, and what are the biggest kind of impact, I guess, ROIs for clinics and staff members, et cetera?
At least from our vantage point, we've seen people on every single part of this continuum, whether it's pre-visit, making sure you're seeing the right patients at the right time, whether it's, immediately before the visit, and you're getting a summary of what you're about to walk into during the visit, and making sure that sort of a differential diagnosis and the recording of information is accurate, or post-visit follow-up and making sure you get what you need thereafter. I don't know that there is obviously a correct or incorrect place to start. I think any of these paths at present has a lot of friction and is less than ideal from an experience standpoint, both from the provider standpoint and the patient standpoint. I think more importantly, what most of these folks should be thinking about is you may have a great wedge, a great use case, a great starting point. What's next? Like, what's product 2, 3, 4? And it's not, to me, necessarily a question of, oh, we started at step A, let's just go to step B because that's what's next. It's more about what's going to bring most value to that type of specialty, seeing that type of patient against like what your product can realistically do. And so that to me is the more interesting conversation of where can you stack rank the amount of value you can create in this interaction versus what the actual flow here looks like from a linear standpoint.
But it seems like a lot we see with this where a lot of founders are kind of coming into emerging markets right now. Every time they kind of, every time I speak to a founder, it's like, I want to kind of focus on X market, but then I quickly do a market research and I see 20 other competitors in that market. And it's kind of getting really overflow with everything going on. The markets are kind of cramped. How do you advise a lot of founders to kind of navigate through these kind of spaces and kind of approach like competition everywhere pretty much, like
I mean, it's a version of the same thing in that it no longer is just having like a great wedge and a great first use case enough, because the second you figured out what that wedge is, I bet I can find a couple of 16-year-olds who'll vibe code that on a weekend and eat your lunch on Monday. And
right.
so the more important question to me is, what's your vision for where this thing goes? Like, you started here and you've got some traction, great. What's the next thing you think has to happen to create value in your practice? What's the third? What's the fourth? What's the fifth? Because that's what's going to create separation, is the fact that you didn't just do one thing right. You understand how to do multiple things right. And you know the order in which that needs to happen because you really understand the workflows and the needs and the actual data you can get out of some of these customers.
I will add is maybe I not as of course competition is always something you need to factor in, but as an entrepreneur, right? Would you rather build a business that there's no competition or lots of competition? I would probably say I would much rather go into the latter, right? Because that means there's a big enough of a market. So I think the right question is like, even if there's competition, be it existing and future competition, how do you actually build a business and a set of products and tools and use cases that's sticky, right? I think one thing I have seen from many of the founders and even some of like my prior lives as a founder, I think some of the maybe a lot of the younger, less experienced founder coming into healthcare often forget, and myself included in my past life, is that you often have a set of tools and then you're trying to convince someone there's a set of problem you're trying to solve, right? So you're a hammer looking for a nail versus where healthcare, there are endless sets of problems, and how do you actually embed yourself and truly understanding that you are solving a hair on fire set of problem and build a specific enough of a workflow that truly will create that to provide that ROI in the near term, but also productize it enough that it's not becoming a bunch of one-off use cases, right? I think that's the tricky thing. And what we have seen, at least in the recent time, and maybe take a parallel industry example, right? Like I know there are companies in the healthcare trying to implement a Palantir-like model. What Palantir did really, really well is that they embedded these forward deploy engineers to really deeply understanding the unmet needs, and then to map out the process and the workflow, and then to build on top of the tools, right? What they're solving, in addition to the technology and the tools, is really to deeply embed themselves into the workflow of their customer when that trust, but also make themselves indispensable when it comes to to the day-to-day operations, right? I think a lot of the founders, especially building in a competitive space, being able to take that approach and to deeply embed themselves, you will see a lot more successes and even break out from some of the very crowded space.
Yeah, and you mentioned stickiness, and I think that's a really good point. Is I think kind of coming into that distribution angle where a lot of founders can kind of maybe outcompete and not even focus on their competition, just staying in their what they're doing and heads down and kind of figuring out like what's the best way to go to a specific place that their competition is not even looking at or potentially kind of lacking. Like, what are your thoughts on that distribution mode as well? Is that a big kind of thing in healthcare, or like is everyone doing the same thing?
My guess is you're more likely to come up with a set of products or a suite of products or order in which they get deployed that someone hasn't done the right way yet than you are to come up with like a set of customers or a problem that hasn't been thought through. I think the reality is we've got so many people in this industry focused on the myriad problems that I don't know if identifying more problems is going to be the unique differentiator. I think it's more about delivery. I think it's more about distribution. And I think it's more about the willingness to really get deep with your customers and understand not just what the problems are, but and not just how they buy, but why. Like, why do they really want what you are putting in front of them? Can you get down to that level? And can you articulate that clearly for everybody? Because if you can, then I'm willing to bet you can figure out the next five things they're going to buy. And that's what will give you a leg up on anybody else who tries to come in the door.
Yeah, I couldn't agree more. I think distribution it's interesting, right? Like of course, for any startup, the initial mode, like especially in healthcare, is the ability to move fast, where the incumbents, be it large companies or even later stage startup, right, are just not going to be able to move nearly as fast. I do think distribution will ultimately be a huge differentiator, but I mean, you can always be dislodged as an incumbent, right? So I don't know how sustainable truly just purely based on the distribution channels can be a mode in the future. But I do think that at least as a company starting to think about like to truly be able to build a mode, like need to really think about what exactly the jobs to be done, right? That the buyers of the solution solving for. Is it financial? Is it for like provider experience and all sorts of those things? And then to increase the switching costs, right? Like so that's one of the ways to potentially maintain a longer mode is like you became so important, indispensable in the workflow, be it financially or even just from a user experience standpoint, where if you can increase the switching costs, which AI in the era of AI, right, that might actually like switching costs in the past of the incumbents are becoming lower and lower. So how do you think about as a new vendor where once you win that use case, and then you can continue to add on top of additional use cases to make the switching costs higher and therefore to build a moat for the customer to continue to retain you.
And does that go with kind of living along the provider's workflows and not really switching them? Kind of mentioning like something that we spoke about in the beginning, where like it's there, these providers are so overburdened, like switching a one workflow to another whole new workflow, which could be the vendors or something like that, is so hard for them. It'll take a while. So is it much better to just embed your product into the provider's workflow where, whether that be via EHRs or whatever they're using, or is there also some feasibility in the case of also having a standalone kind of workflow where you can get providers to adapt to it over time?
I don't think there's a one right answer, but I would say, right, like, so of course, there are certain places where building to the existing workflow is the right approach because we all understand the challenge of change management, right? Like, and sometimes it's just you can give the perfect tool to a user, but if you don't teach them how to use it, it's not going to like drive adoption. And therefore, that's why building into the existing workflow. And we see in the past generations, so many of the clinical decision support tools or other tools want to be embedded into the EMR, right? Because that's the existing workflow. However, looking forward, I think we have all sorts of challenges in healthcare, and then we all understand what we have done in the past like several decades is just not going to work in the future, right? So trying to do the same thing, expect a different result, even with better technology. I think that's like borderline insanity, right? So I think there's going to be a call to action is for some of the newer vendors. I think we often, as an investor, and we're all guilty of that, and certainly myself guilty of that. We look for companies with high gross margin and just selling a tool. But the reality is, in order to truly revamp healthcare, right, you need to bring the right tools, but the people and the process component as a person, I think that's where the technology, people, and process are equally as important to drive that change. And earlier this week, I was with a couple of the senior CMS leader, and Seema Verma also spoke at a conference I was at, right? And they just continue to emphasize the importance of a driving process, workflow process redesign, right? Because I think a lot of the tools that we have right now from the AI, if you use current workflow, it's just not going to get the optimal results.
I've got a slightly different take on this in that I think if you are trying to sell a new workflow as a piece of software, I think it's really hard. I think it's one of the more difficult things to do, irrespective of whether you're selling to a clinician, a benefits broker, or someone who writes clinical trials. Like I don't, it doesn't, to me, it doesn't really matter what part of the industry you're in. But if you're trying to sell new workflow versus building in the existing one, I think it's tough. I think, however, if you're willing to eat your own dog food, that's a little different. Like if you want to say start an entirely new medical practice and have those providers operate in a different way entirely, okay, I think that's got a shot because you at least control the entire experience. And you're trying to create a new Medicare brokerage and you say, I want all my agents to operate this way, then you hire for that profile. Okay, I think that can work. But I think just selling the software, irrespective of how many FDs you put out there and how much, training you do. I just think in doing that in our existing construct and confines is going to be a long hill to climb.
Yeah, and maybe I'll respond, Chirag. I think we are agreeing with each other. My point is, I think there are certain tools that may need to be there's a new workflow needs to be invented in order for it to maximize the ROI of that new tool. Before you start selling that, you'll also need to think about the process redesign. And, of course, in the past, there's a lot of consultants trying to help redesign the system before implementing the new tools. Other ways to think about it, of course, there are companies, even on the technology side, needs to send out like a team to implement to like be a forward deploy engineering team, or even just a practice transformation, right? So I think there's no true black and white in terms of just a pure technology company. Nowadays, with the AI, you also need to provide some sort of services to help inform and educate the clients on how to use the tool and perhaps even redesign some of the existing workflow a little bit.
Yeah. And I guess the point I'm making is like, if you're trying to go for wholesale workflow transformation, I think you've got to own the delivery layer if you're going to do it successfully. I think it's really hard to do that unless you own the delivery layer, just because I think the people we're talking about have been in these roles for so long and are, pretty used to doing things in a certain way. I'm not saying it's not possible to change the workflow. I'm just saying I think it's important to own both the implementation and the actual utilization of that workflow if you're going to be able to do it successfully.
That I agree. And having, how many decades of trying to convince many of the physicians to use evidence-based care, right? Like I think trying to change human behavior is always one of the hardest things to do.
Yeah, and that kind of puts it into like, Chirag, you were kind of mentioning, delivery based use cases and things like that. How do you kind of make a really good delivery kind of And it all does depend on what the obviously the exact use case is for the vendor and their kind of potential contract with the hospital health system and things like that. What are specific kind of, I guess, tech enabled ways, or not tech enabled, but ways that I guess health enterprises and hospitals should be considering vendors? Is there anything that they should be changing in their mindset when it comes to the CXOs and things like that when evaluating these vendors? Like, there's a lot of misconception right there, right now, where, it's, once again, they're all overabundant with lot of AI tools that say we can solve this specific ROI, but they're kind of also going through a lot of maybe potentially misinterpreting a lot of AI tools out there that could potentially help them. Like, what are those kind of ways that they should be kind of helping or evaluating vendors in a more concrete level?
I mean, I don't know that I've experienced the misinterpretation of these tools. I think what I've experienced more of is people who recognize what they can do. And the bigger thing they're grappling with is the change management of putting into place the right way. I think one of the more immediate and near term places that companies have pointed to as far as what they call their ROI or value creation has been labor. And if I'm a health system leader, heck, if I'm a leader of any organization, healthcare or not, while that can be attractive in some ways as a value proposition, I do have to deal with the realities of like, well, these are my people. And I'm going to have to figure out what that means if we adopt said tool or process or change in workflow. And so I think, at least for the health systems, the payers, life sciences folks who need to spend time with, I don't know that I've experienced a situation where they didn't understand what these tools are capable of. I think it's that they're trying to figure out, how do I operationalize this in a way that doesn't affect the morale and mentality of my people who are going to be the ones who either use these tools or frankly will have some of their roles be done by the tools that we're talking about.
And does that go more specifically also to kind of, how about like, and then does that kind of come into more of how hospitals and these kind of health systems have to also integrate, with the startup? And has there been any kind of difficulties that you've seen when it comes to that adoption, like that adoption specifically when it comes to going through compliance and going through regulatory kind of hurdles? Is that something that's going to be potentially increasing as well when we kind of look into the future as well, or is it going to be much more kind of lenient, if that makes sense?
I think I get what you're getting at least like from what I've seen. I think folks are trying to make sure they adopt these tools um, properly and safely. And a lot of them are learning the right way to evaluate and deploy um, and ensure that they're getting the results and outcomes they want with AI. Like that's a new motion for a lot of people. And
Mhm.
so some of them are earlier in the curve in terms of, do I establish a governance committee? What am I looking for? What data do I have access to? How do I regulate that? I think a lot of others are coming up that curve in terms of establishing what their process is. And so I think there is broadly in those hours for people to use, adopt, and evaluate. It's just a question of where they are in the journey of putting those structures in place so that they can do it at an organization.
And when it comes to any contrarian views, I guess you guys have when it comes to the future of VBC adoption, what does that look like overall?
Contrarian view of VBC
Yes,
adoption.
VBC adoption.
VBC is interesting, right? Like, so I know I often joke about as I wear Back to the Future because I'm not that old, but some of my former colleagues on the health plan side, they would remind me when I was still pushing for VBC on the product side that we have already gone through the first wave of VBC, which is HMO, right? The whole HMO movement in the 80s, right? In the 90s, and then now we have VBC. So a lot of the things I would say we have already seen happen. I mean, I don't know if this is truly contrarian since given how long the VBC journey has been. I honestly I think the biggest challenge for VBC is going to continue to be that we're in a multi-payer kind of a healthcare systems, right?
Yeah.
So as a former operator, when I have to go through like anything outside of Medicare Advantage, then you start having different quality measurements across different contracts. You're always going to regress to the mean and basically compare the different metrics that maybe you can only focus on a handful of them across the various different contracts. So my view is that I think VBC, we're still a long way to go to the true holy grail of VBC, which is fully delegated risk. And in the next like 5 or so years, we're still going to see largely VBC contracts that resembles more of a P for P, P for Q type of arrangement, maybe with some sort of upside and downside risks. So I think for us, if we're betting on VBC will quickly accelerate to fully delegated risk, I think we need to temper our excitement.
I don't know if this is contrarian or not, but my view is like it still works. And like it still has a lot of potential to work. I think, like Ian's pointed out, we've gone through various iterations of what it's meant and what the incentives are and where the push and the pull come from. And to me, if you go to sort of the core value proposition of can we deliver the optimal amount of care for what an individual needs and do it under the right incentive structures, like that still makes a lot of sense. And we've got a long ways to go to get there, but it's like I still very much believe in a world like that. Now, how does it change knowing that the marginal cost of care delivery could be a heck of a lot lower in the future? How does it change knowing that we can actually personalize care to what a person needs down to the individual level much more efficiently? Those are, I think, important, adjacent, and slightly different questions. But I do think at the core, if we're not gunning for how can we make sure we get people the care they need, but do it more efficiently, I'm not sure what we're building toward.
Right. Right. How is that kind of relate to, because a lot of times we as startup founders don't really have we don't know if we're shifting towards a VBC mindset with our product. How do we kind of maybe shift our business model to kind of fit those alignments? Like, how can we kind of know how founders should address VBC kind of because most clinics or most hospitals, for example, ECOs are mostly under the VBC kind of model. Obviously, not everyone. How do we know like what the best ways to approach them specifically and understand what they're looking for and kind of fit our product into kind of different capacities that they're looking that they need?
Maybe I'll offer a slide if you're looking for a hot take or contrarian. I think the question about VBC might not be the right one. Here's what I would say, right? So slightly contrarian. I think in some ways VBC is trying to blend down the cost of care delivery, right? To drive value, to pay for outcomes. For the founders who are building net new innovation, one should really focus on how do I develop tools, be it full services, AI native care delivery services, or tools enable better care to deliver care cheaper, faster, and at a higher quality, right? So better outcomes. Because I think ultimately, even if that's the case, you can bring down the total cost of care delivery and maintain equal or better quality. I don't even think you need to go through a VBC angle because fee for service, there are plenty of payers that are willing to pay enhanced fee for service or even today's fee for service as long as your cost and you can match the quality will over deliver it, but also maintain the cost, right? Or even lower cost. Frankly, I think earlier this week, like Chris Klump from CMS, right? Like he talked about healthcare has to go through a deflationary kind of a period, right? So the overall cost has to come down. And I know the famed health economist, Uwe Reinhardt from Princeton, right? Like he always talked about it's the price. So ultimately, we also have seen some other healthcare system. I was born in Taiwan. Taiwan went through like a health transformation in the 90s, actually designed by American economists. It's a almost entirely fee-for-service ecosystem, right? And other than the inpatient DRGs, and it's 8% of total GDP as the expenditure universal coverage, right? So at the end of the day, we should talk about VBC as a means to an end to address the cost and quality problem. But if we can, new technology can bring down the cost, you don't need to contract in the VBC format. You can also build a very viable business model that's fee for service.
Chirag, anything on your end for that one?
I wholeheartedly agree that the paradigm of it is changing. I would say, look, the new administration has actually offered a lot of really interesting entry points. I think as a way for people to step out what's going to work and what's not going to work. I encourage people to take a look at them. Um, and rather than trying to like create your own system of what could or should make sense, let's start with what's already out there and let's see what we can build around those mechanisms. The sort of dozen plus programs the CMS has put in place over the last 6 to 9 months, I think are going to offer a really interesting testing ground and proving grounds for which those are going to be lasting versus not. And I think it's worth conversations with a lot of the big strategics in the industry to understand their perspectives on how or whether some of those programs traverse from traditional Medicare into MA and into other parts of the system. So let's start with the sort of table that's been set, and I think there's a lot of potential in some of the initiatives that CMS has already outlined.
Yeah. Yeah, and this is kind of go into kind of the structural changes, I guess, coming into, I guess, healthcare delivery, payers coming into a full effect, adopting AI as well into into vendors, and we see obviously health systems. Does this kind of change the narrative in 5 to 7 years? What should founders be positioned looking to well position themselves and in those in the future when it comes to better healthcare delivery? And is there anything that current founders could be kind of thinking about now that can kind of prep, for those coming years overall?
I sort of opened this with like the rate of change has been
Yeah.
astounding. And so I will not pretend to sit here and be able to predict like all the different things that we're going to be able to do in 1, 3, 5 years because it really has been something like we've never seen before. And so I think what I more so leave people with is a feeling that as quickly as AI is changing every facet of healthcare and care delivery and provider experience, know that it is also one of the most important things that every major buyer or strategic in the country is thinking about too. They, at least from our conversations, like I'm incredibly optimistic on the ability for the right products and solutions to get deployed as long as people are thinking through the right implications of what their the right implications of the things that they build in. So we've been in plenty of situations historically where the two sides weren't really talking to each other and there was a lot of optimism about, X, Y, or Z, but in reality, when you go and talk to the payers or the providers, that enthusiasm isn't there. I don't think that's the case today. I think there's actually a very mutual agreement on all sides, investors, entrepreneurs, strategics, about the power here. And it's really just about making sure we put the right solutions in the right places.
Yeah, and if I were to add, so I wholeheartedly agree with Chirag. And maybe one thing for many of the entrepreneurs to look into the future. I mean, the pace of change is so fast. I think I forgot who mentioned this phrase, like the speed of adoption with speed of change only goes as fast as the speed of trust. I'm sure I butchered that quote. I would always remind founders, no matter what they do, healthcare is a high stake industry, right? Like, so providers are dealing with patients' health and oftentimes life and death. Vendors who, like purchasers of technology or vendors, are also understanding the implication of patients' health, but also having jobs and business implications on the line, right? So I will always say, no matter what we do on the entrepreneur innovation side, optimize for trust, right? Like you have to go slow to go in order to go fast. So listen carefully, and then because what you're building, it's a marathon, not a sprint. Right. So trust is the ultimate currency in our industry.
Right, exactly right. And Ian, you mentioned as an investor, margins though are something that like you look for higher margin businesses kind of growing over time. Is that still the case with AI right now where, high compute, it requires a lot of, I guess, cost to start building. And at one point, you're not really having that much relatively high margins at first. Does that really matter now? Or is that something that not matters? And just coming from both of you as investors, I'm curious to know where you guys stand on this kind of margin kind of topic.
Yeah, maybe I'll start. I will say, look, as a venture investor, right? So of course there are many different types of investors. Like venture investor, I think historically has proven in order for companies to return venture-like return, right? However, the definition, maybe every firm has a slightly different definition, but in order to get there, you have to have couple ingredients, right? Like one is very rapid growth, sorry, and two is also you need to have a attractive gross margin, right? So does it have to be 80% or 90% like a typical SaaS, or is it 50 to 70% good enough for tech-enabled services business? I think that those are all up for debate, right? Like, but I think if we look at historical, like even publicly traded company, right? The companies that meet the rule of 40 tends to do trade better than the companies that do not meet that criteria, right? So I think as an investor, as a venture investor, we do have to look at companies with a gross margin and also large enough of a TAM in order to have that kind of ability to grow fast, right? But that said, we also fully understand that with the computing and also maybe with some of the costs, right? That's why with venture investor, we're also patient, right? Like we don't need the company to exit tomorrow, right? Well, 2 years from now, we're also seeing more companies staying private for longer, right? So we can
Right.
be patient. I think for founders who are coming to talk to investors like us, they just need to be able to tell the narrative and paint that roadmap, right? How do they, even if today's margins are not as attractive, but how would they be able to, what are some of the key assumptions and driving forces that will lead to margin expansion? Right?
Yeah, and I think for us, this question really just comes down to stage. I think if you're a seed stage company coming out of the gate, honestly spend all your time figuring out what exactly you're building, why you're building it, and who you're building it for. The rest of the stuff around the numbers, like we'll figure out over time. I think if you're a series B, C, D company, okay, let's have some of those conversations about where you're spending money, is the right place to spend money, how we can work on making sure that's all right sized over time. And I only sort of make those distinctions because I think it's important to keep in mind where everyone is in their development. There's some things you should totally overthink in the early days, and some things maybe not. And so I think for me, it just comes down to where you are in the evolution of your company and your product.
Like I'm curious to know from both of your takes about where the role of current startups are right now to the path of profitability. Like, where does that look like over time? Are a lot of startups obviously right now struggling? They're starting to get pilots and then going into kind of working with the practices. How long is it taking right now to kind of get to a profitable state? And is it going to be something that founders should be waiting for much longer in the future and just continue grinding, getting more revenue? Like, where does that kind of process look like now?
I think this is another one that it's highly stage dependent. It's not a
Okay.
conversation that is really having with our companies on the early end of their journeys. It's certainly a conversation that we're having with companies who are much more established and more developed. It is a function of, like I said, A, stage, B, where in the market you're focused, and C, what your goals are as a company and as a founder. And so that's stuff we sort of work on over time with each of our companies. And that's it's a bit of a bespoke answer. But I do think it's certainly top of mind for people as they are, um, as they get more and more mature.
Yeah, I will echo that. I do want to continue to emphasize, I do think a lot of the founders are not thoughtful. Some of them, when even at the early stage, of course, seed stage, a lot of it's you fund it to test for product market fit, right? Like, and then also building the technology. So we're trying to take off technology and product market fit risk off the table to a certain extent during the seed phase. I do think that founders, I mean, we recently went through like maybe the past 10 years, there are certain business models that are just not going to be able to scale efficiently, right? With the cost efficiency ratio is not going to be attractive enough to be a venture like kind of a platform. Again, not every company should raise from venture, right? There are plenty of companies should be privately funded or private equity fund back. But I think for companies trying to talk to venture investors, at least there has to be an understanding of how the margin will continue to improve over the years, right? The more thoughtful a founder could be at the early stage, I think that the person would just give any investors, a lot more confidence to lean in early on.
Right. And, kind of going to the overarching broad kind of concept of like the global versus US centric innovation here, where do the biggest opportunities lie? And, where maybe US can look into other specific countries when it comes to healthcare and the pace of AI, like in other specific locations, or should other countries be looking into US overall on how we're implementing US into healthcare and making it much more kind of, I guess, faster and more adopted? Like, what does that look like? And I know, Ian, you were just out of country. I'm curious to know your takes in between healthcare here versus healthcare there, and what other places are looking at to kind of adopt AI overall in their practices and places.
Yeah, I think there's no one system better than the other. There's no perfect system, right? So I think there's a lot of innovations we can learn from emerging economy outside of the US or even in the mature markets, right? Because sometimes look, like digital payment, right? It was out of necessity in many parts of the country around the world, and that's why there's greater adoption. And are finally getting quite a bit of traction here in the US, right? But there are many things we do here that's far more like US at the end of the day is still the innovation center of the globe, right? So I think we need to continue to learn from each other. Although one thing I would say, there are certain things that in certain parts of like maybe in Asia, things are moving a lot faster is because of the regulatory on the regulatory
Mm.
side, right? So I think AI, couple things I do, I mean, maybe keeping me up at night is too strong. I mean, we're recently talking about some of the liability, and in New York, there's some talks about whether or not who really owns the liability, right? Is it the developer of the tools, or is it the individual physicians? So those are some of the things we as a society we need to solve, right? Because those are some of the things that in other parts of the world it doesn't happen, right? And
Yeah.
perhaps with less regulatory hurdle, some other countries can advance a lot faster than we are, right? From innovation standpoint.
And that specifically, is there anything that, any advice for founders that are trying to sell internationally when, they're at that specific stage? And maybe you guys had portfolio companies working on that. Has that kind of been different from what it was 2, 3 years ago for companies that are trying to potentially sell out of country, or is it still relatively the same?
We don't have a lot of portfolio companies selling internationally, but funny enough, we have a couple portfolio companies have been approached, or at least people reach out from internationally. I know we talk a lot about clinical AI,
Yeah.
right? At some point, AI can be this autonomous agent to deliver some sort of clinical activities, be like the doctronics.
Yeah.
But I think you can see in a world where in certain parts of the around the world they have to adopt a clinical AI agent much faster than here in the US out of necessity, right? So if you were to expand some of the company having the ability to carry out the use cases internationally and then bring it back to the US as they continue to perfect the model, I think you might be able to see some reverse innovation or even some of the US based companies that can potentially address a different market while waiting for the regulatory framework to mature here in the US. But
Interesting.
we're still in the very early stage of things, right?
Yeah, I know for sure. Looks like Chirag had to jump off, I'm assuming. But
Yeah.
yeah. But look, it's amazing to have both of you guys on the show. And I enjoyed this so much. It was a pure joy. So thank you guys for so much for being here. I truly
Well,
appreciate Yes.
Thank you so much for having me. It's truly a pleasure to be on this podcast with you and Chirag.